Hey everybody, Grant Miller here, Miami Community News. It's holiday time and I'm with Penny Shaffer, Florida Blue.
Hey, Grant.
Woo woo!
Thank you.
So I got a gift from Florida Blue. At first I thought it was chocolate, then I thought it was cake.
If I had known, I would have brought you chocolate. Who knew?
But this is it. I'm in. I'm on the team.
He's the man of the hats. It had to be a hat.
Florida Blue. So it's hard to believe I haven't seen you since March.
Is that possible?
Yeah.
Oh my gosh.
And
okay.
I know Florida Blue is just rocking and rolling because I go to a lot of events and Florida Blues talked about. I met your rep from the Falls location.
Excellent.
And he was talking like it was his home. He was so proud of it. So how's open enrollment doing?
So open enrollment has been busy this year. It feels almost like the year's been perpetual open enrollment. We started the year off with the American Rescue Plan, which gave people access to new benefits and the opportunity to get back in there. And then you go into the special election period, as they call it. So, right. If there's been some exception that's happened in your life. And that ended in August. And now here we are in November at the annual open enrollment period. And so it's been a busy year. But a good year for everybody, for sure.
Yeah. There is the Affordable Care Act. Everybody gets confused on it. What is it? Open enrollment works? How does it all work?
Sure. So the way the Affordable Care Act was designed was to give an open enrollment period to allow people to select their benefits once a year and then settle in for the rest of the year. So open enrollment period has moved around. The dates have moved around, but the core is really November 1st to December 15th. If you want to have your benefits effective for January to get you through next year for 22, you really have to get those selected and all the paperwork finished by December 15th. So we're right now in that 2-week period of, get her done so that you're ready January 1st.
Hey, every time I look at you, do not age at all.
Oh, you're the sweetest thing.
I mean, it's just,
I don't know if you remember meeting my mom somewhere along the way. At 87, she didn't have a wrinkle on her face. So, from your lips to God's ears.
You're only 50, so you're fine.
Yeah, right.
Okay, so how is it different this year? What are the dates different? Are they a little different?
So it's a little different this year. It is November 1st to December 15th if you want your benefits effective by January 1st. They have allowed for an extension into January 15th for people to enroll. But from the 15th of December to January 15th, if you apply then and do your paperwork then, it won't be effective till February 1st. So, don't want anybody to be misled or misunderstand any of that. If you want your benefits effective by January 1st, get that paperwork in and complete by December 15th.
Just to change the subject, as I always do,
OCD,
ADD. I'm turning 65 in February. I'm so excited.
Okay, so what I want to tell you to do, and anybody out there who's about to turn 65, you have to enroll in the government's Medicare program before you can actually go enroll in a Medicare Advantage plan. They tell you can do Medicare A, B, and D potentially. But what people don't always understand is you've got to be enrolled in Medicare with the government.
Yeah, you just can't call up, hey, I got Medicare.
No, and you can't just do that overnight. It takes about 3 months. So,
I know, I already did.
So I would say make sure you get that done.
I did it. I don't believe it.
I turned 65 October 1st, and believe me, I was scrambling from July to get her done in time.
I called the government, and they said, yes, you're good. You'll get. Oh, I did get my card already, so I'm in.
Well, that's good. Once you've got that card, you got to have the number. You got to have that number.
So I'm like, my insurance rate, what? So it's a great thing when you turn 65.
There is a lot to be said
when
for turning
65.
I did already. No, October 1st. I did.
Look, you have no wrinkles.
Do I need to get the license out and prove it to you?
Maybe. Okay. When people, who benefits the most from enrollment periods? Anyone particular, or is there type?
So the enrollment period is for anybody who's in individual insurance, no matter how much money you make. If you're buying individual insurance, so you don't get it through your employer, and you don't, like us, get it through the government because of Medicare. So if you're buying it on your own, this is the time to pick your new plan. If you qualify for any of the premium assistance dollars, you need to do that now, and you need to do that officially through healthcare.gov. So you talk to an agent or broker, they can help you through that. Make sure that your doctor is in the network if you love your doctor. Make sure that your medications, if you take any medications, are covered in the plan.
I don't have any medicine now.
This is wonderful. Now you're taking your vitamin D because you're stuck in this studio all the time. Do you get enough sunshine?
I'm only in here twice. No,
okay, so make sure you're getting enough sunshine.
But I take vitamins, but I don't. So it's funny. The guy says, "Well, you don't take any medicine now, but don't think you might not need it later. So be smart about it."
Well, I like the fact that you don't have to take any now. That means you're taking care of yourself. Good for you.
Yeah, I've had border high blood pressure my whole life, so it's not. That's just my.
See, I have a policy. I give other people high blood pressure. I don't have it myself.
So here's the big question we all wonder. You know, you read community newspapers, you see all these health plans, and you watch. You know, I don't watch TV, so whoever's advertising on TV doesn't get. But how do we know which one's better, other than the spokesperson?
Sure. So the key to remember is when you go look at your plan, you need to make sure it's affordable for you, and that's not just the monthly premium. You need to make sure that the deductible is something that you can handle. The deductible is the piece that you pay out of pocket before the insurance kicks in. And there's maximums. The government has put maximums on it, but you want to make sure that you've got at least that much kind of in the bank so that you're ready for those first dollars of coverage. You want to make sure that you understand, what the co-payments are. That's the cost share that when you go visit a doctor, hey, you pay 10, the insurance company pays the rest, or if you see a specialist, maybe you pay 25.
And some of these co-pays are ridiculous. You go to a doctor, your co-pay is $165.
Well, that's an unusual plan.
Whatever.
But but you need to know.
But a consumer gets very frustrated.
Make sure you know before you buy how much of all of that is included. And then make sure that the doctors that you see and that you like are in the network. That's what it's called. And so you can find that out in advance. And not you, but the rest of us who do take some prescription drugs, make sure they're on what's called the formulary so that you don't have to change your medications. You don't have to change your doctor. It's all in there. And I personally recommend that you speak to somebody because it's complex. Let's just be honest. It's complex. So you should probably speak to somebody, whether it's an agent or broker, visit one of our Florida Blue centers, pick up the phone and talk to somebody. But you really should talk to somebody about it to make sure that you're making the right decisions, that even if you feel comfortable, you've checked all the boxes and you believe you've got it right, verify that with somebody.
Everybody panics regarding insurance. Do I get the right one? And is it that important? If you got an insurance company that's good, but they don't carry a doctor, do you go to another insurance company that doesn't carry? It gets confusing.
It can. So a lot of it depends. A lot of people are very wed to a specialist. So if you have a cardiac condition, or if you're a cancer survivor, you're pretty wed to your specialist. Most people, if my primary care physician isn't on it, I see him once a year for my annual physical. I'll switch to make sure I get good, solid insurance and good, solid coverage. But when it's your specialist, I can see why you'd want to check and make sure that the specialist is in the network so that you don't have to make those kinds of changes. I believe, obviously I work for an insurance company, but I chose which one I work for. And I believe that you want to look for somebody who is stable, who has history in the market, who has history in this state, who understands how to interact with people in the state. We insure 5 million people across the state of Florida. I think we know Florida pretty well. So you want to be careful that you've always selected an insurance company who's going to be there, who's got the staying power.
To me, I think the customer service is the most important. When you call an insurance company, you don't want to be battling. You want to be able to somebody that you can communicate with. You need good customer service, and Florida Blue has great customer service.
Thank you for saying that. We've tried to design systems such that we will meet you where you are. So if you're one of the people who likes a smartphone and wants to interact via smartphone, the app is amazing. You can do an awful lot from that app.
I want to talk to somebody. I need somebody to.
If you want to talk to somebody, some people want to do that face to face.
I'd rather do face to face.
So our Florida Blue centers across the state, and
they all look like the one in Falls.
Most of them look like the one in the Falls. They have the same look and feel as the one in the Falls. Here in Miami-Dade County, I've lost track. I think we have 9 across the county between the freestanding ones like the one at the Falls, the one in Hialeah, the one in North Miami. But then we also have Florida Blue representatives sitting in the Sanitas clinic locations where you can see them. Kendall, Doral, Miami Lakes. There's a number of those. And then if you're watching from Broward or Palm Beach, we're also at Sawgrass. We're also at Boynton Beach. And we have agents embedded in locations to help you with both your acquiring as well as your servicing needs. If you're the kind who wants to do it on the phone, you can do it on the phone. If you want to visit a website, you can visit a website. I kiddingly say call, click, or visit. Whichever is the right place for you and the way you want to do this will be there for you.
I'm not tech, really tech guy. So I'll go, I like to somebody in person and I go, here's my phone. Do it for me. And they do it.
And they will.
Yeah.
They will.
All right. So health insurance, people, sometimes it's out of their reach financially. It doesn't go through the job. They can't afford the right health insurance. Where do they find
the good news is it's really not out of reach anymore. The Affordable Care Act, affordable care, that's the point, put together a program that provides a sliding scale of assistance. So if you're anywhere from 100% of the federal poverty level, so think about somebody who makes around $11,000 a year, all the way up to if you're at 600% of the federal poverty level, there is some amount of assistance there for you. The American Rescue Plan expanded that. And so that made it possible to go all the way up to the 600% level. So if you're at 250% or below,
where do they find that?
You're going to pay zero premium, maybe zero deductible, maybe zero copays. So it is pretty affordable now. You can go to healthcare.gov. Healthcare.gov. Right now, you can shop for plans and all that. Again, I personally recommend that you reach out to a Florida Blue agent or a broker.
The phone number's on there
to verify what you do your shopping, but just call to verify that you understood it, you read it right, you got all the right points, the doctor's really in, all those kinds of things, and just verify. But you can do the shopping right now at healthcare.gov.
Okay. Florida Blue has some different levels. They got gold, they got silver, they got bronze. What is that? Because it's a little confusing.
Sure.
For me.
So what the government wanted to do was to make sure that as people did those comparisons, that they were kind of like for like comparisons. So the lowest level is called bronze. It'll cover about 60% of your annual cost of health care. Next is silver. It'll cover about 80%. Then gold, then platinum. Think about it like the Olympics. The higher the value of the medal, the higher the value of the plan. And so people who are kind of heavy users of healthcare find that the gold plan is pretty good for them because it may have a slightly higher premium, but it has lower deductibles or lower cost shares. And so if you're a frequent user, that can count for a lot. People who are, pretty much the young invincibles who say, look, I just want to make sure I've got coverage so I can see the doctor, hopefully nothing catastrophic will happen on that. They're bronze plan users. It'll cover your doctor's visits and it'll cover, it's comprehensive care. It still has all the benefits, but you can rely on, pulling out of your pocket if something really unique happens.
We have George Martinez in the audience. So I was just thinking about him. He's a Columbus grad and they have this called Columbus Connection. Well, Florida Blue has something like that too. It's called Blue Connection Care.
Okay, so
I'll just try to clue you in, George.
Thanks, George. George is very connected in so many more ways than just
not just Columbus Connection, but Blue Connection
Care. He's connected. So think about My Blue Connected Care. We learned particularly during the pandemic, the technology's been around for a long time, but we learned during the pandemic, all of us learned that access to virtual care, the ability to have a doctor's appointment using virtual technologies or, televisits was pretty important. If you think about it, we used to go see the doctor with a complaint. They would send you to a lab. You'd come back to the doctor to go over the lab report and so forth. So, you're 3 times away from work or away from home. Now we've learned, wait a minute, that first visit could be a televisit, talk to the doctor. You do have to show up for the lab probably. But then for the follow-up, I could talk to the doctor and we can talk about the lab results and what do we do from here. Pretty interesting. Most of those televisits were with a telemedicine company where you were talking to a clinician, which is important, but it wasn't your medical home. It wasn't your doctor and their team. My Blue connected care 24/7, but you're talking to somebody who's in your medical home. They have access to your records. They know what medications you're on. They know the visit that you made a week ago. They know all of these things about you. And so 24/7, it's like calling your doctor's office. It's like visiting your doctor's office. It's not with a stranger, it's with your medical home. Now, it may not be your doctor. It may be a physician's assistant that's in the practice. It may be a licensed, a nurse who's in the practice. They're all clinicians, but they have access to all your records as opposed to calling up. It's like visiting the emergency room. They don't have access to all your records.
Right. So you could speak to your doctor.
It could be your doctor, but because it's 24/7, haven't met the doctor yet who could be 24/7. So it's going to be in the practice.
Well, I think it's important. It's like I had a thing on my face, and the doctor told me the doctor looked at all of my, I was checking to make sure I didn't have cancer, and the
good for you for checking. Thank you.
And the
note.
So when we were done the next day, I said they didn't talk about certain things. So I called the office, and one of the people in their room got on the phone and said, I pulled out the record, and yes, Grant, don't you remember? And I go, oh, yes. The point of it is, it wasn't the doctor, but it was part of the team.
Hey, it's a great clinical team, and most people should be very, very happy with talking to anybody on the clinical team, because what you really want are answers from clinical specialists. It doesn't always mean that you have to talk to the doctor.
But you feel better.
Absolutely.
It's like when your doctor says you get the secretary, you call the secretary, you're fine. No, doc, I want to talk to somebody, and whether it's and it could be the nurse, or anybody in the clinic. Yeah. So it's all good.
One of the things that people make phone calls back all the time for as well is, I had those labs done. Now what? Now what? And, some medical practices are, well, nothing was wrong, so there's no follow-up to do, but you're still wondering. And so on some of our apps, and I mentioned Sanitas earlier, we're, 50% joint venture owner in this system across Florida called Sanitas. And so as soon as your labs are completed, that lab work is available to you on your smartphone. You can see it for yourself, and it gives you the actual value, but it also gives you what the normal accepted range is. So if you see something that's out of balance or whatever, you can confer with the doctor about that, and the doctor's likely to call you. But you're just sitting there, I don't know. And so you're calling the doctor's office going, hey, have the labs come in yet? We're going to tell you right away, and we're going to tell you the values, and then the doctor's going to follow up with you on anything that was outside of the range.
Gotcha.
Really changing the communications around your healthcare.
How do we get people to help enrolling for your health insurance plan? A lot of questions. Are you eligible? Finances, how they access information. What's the easiest way for it?
Well, of course, if you're watching this, I want you to notice that, we definitely have the website, but if you prefer to talk to somebody live, there's a number there. I strongly recommend that you talk to somebody live, just to understand all the things that are available to you. I just described the federal poverty level from 100 to 600% of the federal poverty level. You're eligible for premium assistance. You may be eligible for a 0 deductible, a 0 copay, 0 premium. Imagine, and all it takes is a phone call to find that out. And so I strongly urge people, if you don't receive your insurance through your employer, make that phone call and find out.
Florida Blue is not just Miami. It's all over. And it's not just the standalone. You're in a lot of clinics.
I will tell you that we are the only insurance carrier who has been in all 67 counties of Florida since the Affordable Care Act passed, and for 70 years before it. Others can choose to go into major metropolitan areas, and some have come in and left and are come back again. This is why I say, really think about who it is you're doing business with. Who has the staying power? Who's committed to this community? We are a not-for-profit insurance company. We are committed. Our policyholders are our owners. We're not publicly traded. It's not about the share price. Our policyholders are our owners. I want you to think about being with a company who's committed to the community you're in anywhere in Florida, over 75 years of doing business, all 67 counties, we consider this our mission. This isn't just about coming in, making a dime. When it's hard to make a dime, you leave, and then you figure out when you come back to make a dime again. That's not who we are. That's not what we're about.
You bring up something interesting. Is the same president? I heard him speak a couple years ago.
Pat Garrity.
You leave, was it Coral Gables Chamber event?
It could have been.
I think it was at a Coral Gables, and he took his jacket off. I remember that. It was at the Hilton or something like that. This guy, I was so pumped up after his speech because he talked about not Florida Blue, he talked about health.
Yeah.
And it was, it was pretty emotional. I mean, he talked how it grew, and he's an inspiration.
He is an inspiration, and it is a joy to work with him every day.
Speak about it. Are you retiring?
It's true. That's one of the things I'll miss when I retire is working with Pat every day. He's an amazing individual. But you just heard 65. That's that magic number that we all go looking for. I've been in corporate suits for 43 years. I think it's time.
Okay. At community newspapers, our retiring age is 95.
Okay.
So I got 30 more years.
Well, it's not obligatory that you.
I'm working.
Okay, good for you.
I'm working.
Well, you know me. I won't be sitting around.
I know you'll be.
I'm not going to be counting.
Well, you're going to be the incoming chair at what?
At the United Way. I'll be the chair starting next summer.
Exciting. But let's talk about Florida Blue. And I noticed this more than anybody else. Dade County. I don't know about anywhere else. Florida Blue touches a lot of lives in the business community. You guys support a lot of things. And then I know in Surfside, you guys did a lot of it with Surfside, correct? Because today, Dade County, I was down there. Calva and Pepe Diaz honored the police officer there at Surfside. Yeah. Let's talk about Surfside.
So, yeah.
And all the stuff you guys do in the community.
That was a tragic event. And unfortunately, our community, our broader community has suffered through a number of these kinds of tragic events. One of the things that we believe, again, we are a mission-based company and we are a part of this community. And so when those things happen, we try to immediately respond in ways that we can make a difference. And so the first thing that we did after Surfside and have done after the bridge collapse, after the Parkland shooting and some other things, is to activate a 24/7 helpline so that people who are feeling anxious about what happened have a way, they have a channel to share those feelings, be reassured, and really get direction to care that they may need. That phone call may be enough, but it may also be that they need additional help and we can get them to additional help. Second thing that we immediately do is we look for how do we support not only the individuals who've been impacted by it, but also how do we help the first responders, because both need physical care, financial care. They need meals. We worked with the Miami Heat to bring meals in to make sure that meals were available. We supported several of the organizations that were making available. You think about it, so many people who could not go back into those buildings. We provided, assistance with gift cards to help them access supplies that they needed and access to care.
Just life.
One of the things that we learned from that one in particular, we worked very closely with the American Red Cross. And what we learned is the American Red Cross can come in and spend a couple of weeks on the ground doing sort of that first responder kind of help. But if you think about it, the emotional impact of that was going to last much, much longer. We learned this from Parkland as well. The emotional impact of that was going to be much, much longer. So we worked with the American Red Cross as well as others in the community to put together really a collaborative for long-term mental well-being when these kinds of things happen. And there's now 60 organizations that have come forward that are offering their own staff, their own providers, their own doctors that are trained in trauma-based care so that nobody in this community, regardless of your insurance coverage, regardless of your situation, nobody in this community has to live through the anxiety alone. There is a pathway to mental well-being.
So Florida Blue has some mental health help in there.
Oh, absolutely.
Because, when I say we, 99% of Dade County was not physically hit by Surfside, but everybody
was emotionally hit.
Emotionally. It's like, the shooting in was just a shooting. I don't even know what state it was.
Michigan had one recently,
Yes,
but unfortunately, it's all too common.
But I make a point. Mental health kids they hear about it and they get nervous. So that mental health you have policy help within the Florida Blue if you sign up with Florida
Absolutely. And I will tell you, even our vice president of behavioral health, who's an amazing guy, Nick Dewan, he's one of the advisory board members for this collaborative that's come together. But he will tell you that mental well-being, there's a spectrum of services that are available to you, and they don't all require clinical encounters. You don't have to see a psychologist. You don't have to see a psychiatrist. Sometimes there are podcasts and other things that will help you to feel good again, to feel comfortable again, to feel stable again, to acknowledge that it's okay if you don't feel good right now, but you could, but you don't necessarily need to go see a psychiatrist.
In the past, it was not okay not to feel good.
Oh my, yes. Taking the stigma off of it's okay to today not feel okay. And it's okay to talk about that with somebody. And that doesn't automatically mean that you need to go through a full clinical behavioral health.
So for me, when I get a little depressed, I go to Arbiters and eat hot dogs.
Me too.
I love Penny.
My gosh.
God, Penny.
They do a good West Virginia slaw dog like nobody else does. They understand me. They get me.
So we're talking about mental health. COVID. I think that mental health, forget the COVID itself, but the mental health issues is heavy. What have you guys done about COVID? And I know you guys are doing some special things for COVID.
We are doing some special things. Well, there are situations that existed pre-COVID, and we all know that the opioid addiction rate in this country, and unfortunately the death rate, was high before COVID. The level of isolation that was required in order to cope with COVID put people in some very unusual circumstances, and self-medication or the ways to cope with it included, unfortunately, an uptick in the use of opioids, the use of alcohol and other things. And the opioid death rate rose, obviously, with that. And so we have launched statewide something called Project Opioids, which is to try to address root causes for opioid use, addiction, and unfortunately abuse, and to get ahead of that. As an insurance company, we've taken some steps to help on the what you'd call the legal access to drugs. So you think about it, you go visit your dentist, maybe there's a little bit of pain, they give you a prescription for 30 days of a painkiller, and you go, I might take one. Why do I need a 30-day dosage sitting in my closet?
But then the other hand, the doctor goes, I don't want you to come back 4 different times. But like for me, you're right. I have a pill. I got 20 pills in it.
So we've shifted some of the allowable amounts for these kind of things that have, and step therapy and some other things that are for the legal versions. We no longer will cover the crushable version of OxyContin because it's the crushable version that can then be spread to other things. That's the legal side of it. And then we have, unfortunately, the illegal side of it, which is, the use of fentanyl. So we've pretty well restricted the supply of the legal doses that would be sitting around in people's cabinets. Now we got to work on the fentanyl side. So Project Opioids definitely is going to help with that. But if you also think about it throughout COVID, trying to make access to resources more available to people so that if they were feeling stress, if they were feeling anxious, if they were feeling isolated, we couldn't change that they were going to need to continue to be isolated and for their protection, but we could make access to resources better. So you can actually have an encounter via cell phone, via text, via video, via virtual to try and help people through that.
GuideWell. What's GuideWell?
GuideWell's the parent company. It's a mutual insurance holding company. So all of our members are owners, policyholders are owners in GuideWell. Under the GuideWell umbrella are a number of companies. The biggest one is Florida Blue, as we all know, the insurance company. And then there's some other companies that are under it. One of them is called GuideWell Health, and that's where all of the assets that actually deliver care, that actually lay hands on people, sit. So in our community, that is the Sanitas, as I mentioned, those integrated healthcare models, clinic systems that we have throughout Miami-Dade, Broward, Palm Beach, all around Orlando, all around Tampa, and expanding all the time.
What's the most frequent question they ask about open enrollment?
So most people are confused during open enrollment about, I don't know how to get started. I don't know how to figure this out. As you mentioned, there's 90 plans. How do I go figure those out? Most important question I think you need to do is get on the phone with somebody who asks you all the right questions so that they can help guide you to the plan that is the best for you. And by the way, licensed brokers and agents are required to put you in the best plan for
So
you.
if you have a car agent, let's say my car agent's State Farm, should I call him?
No, I would call somebody who sells health insurance.
so
So
I'm
we're flashing a number on the screen. That'll make it really
Okay,
easy. Just
so
call
if you
that
call Florida
number.
Blue, they will help walk you through it.
Absolutely. They're
Okay.
going to ask you a whole lot of questions, which is going to feel like, wait a minute, why are they asking me all these questions? The only way to tailor make the plan for you, to tailor what they put you in, is to know the answers to those questions. So who are the doctors you see? What prescriptions do you take? How much of a deductible, what can you afford to pay out of pocket before the insurance kicks in? How frequently do you see a doctor in a year? What are the medical conditions that you may have? They don't ask you those questions because it's going to impact your rate. It can't. By law, it can't. There's only two things that impact your rate: what age you are and what county you live in. That's it.
The most important thing we need to know about open enrollment, when the start and ends. I
would say the most important thing I can tell you today about open enrollment is if you want your coverage in place January 1st, you have to sign up by December 15th.
So if you're switching,
make sure you get your paperwork done by December 15th.
In our community newspapers, everybody in our staff, 45 people, 44 of them have 2 shots. We only have one person who doesn't believe in it, and he works a later shift. Most of the people that are over 30 have got 3 shots, and most of the people have got 4, got the flu shot. What else can we do?
Well, no, I think you're doing the right things. Now, continue to practice, safe. We all need to use our hand sanitizer. And by the way, that's just for regular cold, cough, flus, and things like that. I'm going to cough on cue.
Now that you said it, you cough.
Cough on cue.
Hold on.
Make sure you're using that hand sanitizer. I think that's a practice that we should use forever. Distancing is important, just because of what we're talking about here. The good news is we're seeing the case counts drop so that you're starting to see people out and about a little bit more. You and I don't have that big plexiglass screen between us right now, but it's still important to practice safety because it's not eradicated. We just have it under control right now.
Right. I look at it as the flu. Before this last season, I never got the flu shot. Now, they tell you, go get the flu shot. Didn't do it. Now I'm getting it. And people say, I don't want to get the COVID. But I think the COVID is going to be like the flu. Go get your yearly shots.
So I think there's a couple of things to make sure that we're highlighting. One is the COVID vaccine and booster is designed to reduce the impact of COVID should you contract it. So it doesn't prevent you from getting COVID.
Even with the booster.
It doesn't prevent you from getting it. But what it does do is it makes all of the symptoms much milder. The chance that you would end up in a hospital is practically eliminated. And so it's protection. It's protection. The flu vaccine, same thing. Looking for the most popular strain of flu that could come around, and it protects you against that strain. That doesn't mean that there aren't other flu strains that could be out there. And right now we're seeing something that they're affectionately calling the super cold. We've all been behind closed doors for 18 to 24 months,
right,
and we haven't built up that natural immunity. A cold is just a virus.
Right.
Well, the cold virus that's out there right now, instead of being the 1 week like we're all used to, whether you treat the symptoms or not, it's pretty much a week. This super cold is actually lasting about 3 weeks. And it's not going to put you in the hospital, but you're going to find that your cold symptoms, that, sniffling, sneezing, coughing, may last just a little bit longer because we haven't built up the immunity to that particular virus because we've all been closeted away.
I have to thank the mayor of Dade County and the county commission because they have made it really easy to go get shots.
Oh.
Tropical Park's open 24 hours. I go every Wednesday and get my weekly checkup. And, I find out
Good
the next
for
day.
you.
But then one doctor said, Grant, why are you wasting your time? Because you might have it before, you might have it after, but I was just being cautious. And I still do that. But if you get the virus, you go to Tropical and they give you these 2 shots in your shoulders and 2 shots in your stomach. And it's like,
so
what about that? What is that called?
What I would tell you is to make sure that you interact with a clinical professional. So talk to your doctor, because what we were telling people early on in COVID is if you're having the symptoms, guess what? These symptoms are similar to other things. So the first encounter, even if you do it virtually, it should be with a clinical professional, your doctor, a physician's assistant, because they can actually potentially rule out COVID based on the collection of symptoms that you have. So don't want anybody to automatically diagnose themselves. I really want you to take advantage of seeing a doctor or a virtual visit with a doctor. Let them work through the symptoms with you to either rule in or rule out, and then follow the treatment plan that's right for you, whether it's that set of shots or other things.
What's it called? Those shots after you get it? It's a Trump shot, I call it.
Hey, listen, I'm a different kind of doctor. I'm not going to do clinical on your show.
Okay, so, but what's interesting is I know somebody who's obese, got it. He had 2 shots, not the booster. Goes, gets the 2 shots in his arms, his stomach, and within a day he felt good. Still had the virus, but he felt good. He went into his private office, worked, but it affects people different ways.
The key is to pay attention to your body, and your body will tell you. And don't be brave about it. Make sure you reach out to a clinical professional.
Okay. You were with Florida Blue 15 years.
Almost 16, yeah.
And then 26 with AT&T.
I know. I'm telling you, I'm old.
And Barry Johnson was with you at AT&T back then?
It's true. It's true. He was in the domestic division. I was in the international division.
Wow. Yeah, Barry's still plucking away. I see him probably once every couple of weeks.
Yeah,
I see him.
great guy.
Because he lives in Broward. His son lives in Cutler Bay.
The man covered a lot of miles over the years.
Oh yeah.
Both for us at AT&T. I say us at AT&T, and then when he was at the Greater Miami Chamber of Commerce.
Well, we're not sad for you to leave because you're retiring, and you're not really retiring. You're retiring from this job.
I'm going to still be in the community. I'm the past chair of a few things that they're nice enough to let me come to meetings every now and then.
Well, past chair of Greater Miami. What else? You past chair?
Beacon Council.
Beacon Council.
I'm still on the Miami-Dade College Foundation board, and I still run around with those guys from the Orange Bowl. Hi, guys. And
Dave Heffernan has a show every Thursday, and he's secretary. So I guess in a couple.
He's on his way.
He's on his way.
He's on his way. So there's plenty. And you mentioned earlier, become the chair of the United Way board. This is my community. I have sand in my shoes, and I'm staying put. And so I want to make sure that we continue to make this a great place to work and play
and learn. I learned that work, live, and play, and learn.
And learn.
Because Miami-Dade has stepped up, FIU stepping up, and the 2 new presidents of Florida Memorial, who used to be an athletic director.
And Barry.
Guess what? St. Thomas was former AD. The guy from Barry, former AD, became president. So we got all these new presidents. 3 new those colleges, Florida Memorial.
So it's championships on the way for us.
Yeah, but it's this great education in Miami. It used to be just Miami. Now FIU kicking butt, and Miami-Dade is driving the force to all these other colleges.
You got to figure every 4 years you're building a new team. So.
Oh, good. So live, work, and
Cut
play.
Some slack.
I'm excited for you because I'm probably going to see you more with United Way.
There you go. It could happen.
Community newspapers.
You and I'll get in the car together.
Oh, I'll drive you around. I'll be driving.
Hey, we could start carpool karaoke together in Miami.
Absolutely. I'm Morgan Freeman. I'll drive you everywhere. It's an honor, and really what you've done for our community is great. And I know it's going to continue. It's going to even get better because now you're going to be answering to 3.2 million people with United Way, correct?
I love it. I love it.
As always, Penny Shaffer, Florida Blue. Have great holidays, everybody. Grant Miller here. Thank you very much.